Welcome to this month's Fit for Colorado Talk to the Doc chat. I'm CBS4 anchor and health reporter Kathy Walsh. For the next half hour, we'll be chatting about fitness and health issues here on CBS4Denver.com. Throughout this chat, we encourage you to ask questions by simply typing them in the chat window at right, and we will do our best to answer those questions. In today's chat, we're going to discuss healthy aging and maintaining brain health. According to the U.S. Census Bureau, the world's population of older people is growing at the fastest rate ever seen. The old will soon outnumber children under age 5 for the first time in history. The number of people 65 and older hit about 506 million as of mid-year 2008. This will double to 1.3 billion by 2040, accounting for 14% of the total global population. Now, in the U.S., the senior citizen population appears to be headed for a 40% increase over the next 5 years. Baby boomers are aging, and medical advances are keeping us alive longer. So how do we stay physically healthy and mentally sharp? We work so hard to keep our bodies healthy. How about our brains? Well, I recently met an 80-something stroke survivor who makes healthy aging look easy.
Who can say how much a smile should cost? Maybe it's the difference in the soul, saved or lost.
Flora Liston writes poetry in her free time when she's not exercising or tackling jigsaw puzzles or brain teasers or volunteering at Spaulding Rehabilitation Hospital. Flora's been helping out at Spaulding since 1988, ever since doctors there helped her recover from a stroke.
My left side was completely paralyzed. I couldn't move anything over there.
21 years later, Flora is still up and active. This 84-year-old mother of 9 believes if you sit still, you get stagnant.
If water stays in the same place too long, ooh, it looks bad and smells bad. So now, why would a person be any different than that?
Flora's philosophy is use it or lose it.
Is Flora the poster child for healthy aging?
She actually is.
Clinical neuropsychologist Cami Chakota believes to maintain a healthy brain, you must stay physically, cognitively, and socially active.
I could only hope that all of my patients would be as active on all those domains as Flora is.
Dr. Chakota recommends a low-fat, low-cholesterol diet, exercise to keep your blood vessels elastic. A crossword puzzle a day can work your brain, or try something new, like this word scramble. Stave off depression by doing. Poetry helps Flora stay positive.
Our usual greeting of adult or child should always be prefaced by a great big smile.
And joining me today is Dr. Cami Chakota, clinical neuropsychologist at Spaulding Rehabilitation Hospital, and Kim Gorman, registered dietitian and weight management program director of the Center for Human Nutrition, UC Denver. All right, Dr. Chakota, you like to say what's good for your heart is good for your brain. What do you mean?
Well, you know, there's a lot of information in the news and within the dietary field, I'm sure, as you know, about being heart healthy. But the thing that we all need to remember is that a majority of our blood goes directly from our heart to our brain. And what we put in our bodies, therefore, is going into our brain. So things like cholesterol, fat, high sodium diets, if you have high blood pressure, all things like that, you know, put us at an increased risk for stroke, as well as heart attack.
Mm-hmm. You suggest a number of ways to maintain brain health. Let's take a look. We'll go one by one, okay? So first of all, I noticed that you said manage risk factors. What do you mean by that?
Well, there's a lot of risk factors. First of all, you know, one of the most important to remember is family history. So if any of us have a family history of anything like Alzheimer's disease, Parkinson's disease, those are really obvious risk factors that we're aware of. But there are others, for instance, high blood pressure or hypertension, high cholesterol, obesity, just kind of being stagnant, not moving a lot. You know, it's important to, like you said earlier in that shot, to keep our blood vessels elastic and able to withstand increases in blood pressure. All of those are risk factors that we need to manage because we know that those are reversible causes of things like stroke and heart attack and vascular dementias.
Sure. So, Kim, folks who come to you, they fight genetics all the time, don't they?
You know, one of the funny things, well, maybe not funny, but you're looking at age. We're talking about aging. Aging, you can't modify. You want to have more and more birthdays. The other one is your family history. You can't change what it is. And so I think it is really important. A third one, gender. You know, man, woman, once you get past that menopause for women, that's when that heart disease risk tries to catch up there to the men. We don't have the estrogen protection any further. So I think those three you can't modify. So you look at the other side, and that's really what we work on, is say, what can you work on right now, today, to get started? And so we look at those risks for diabetes and how we can improve the diet and physical activity, and we look at the blood pressure, and we look at hyperlipidemia or high cholesterol. And I think one of the primary focuses for lifestyle change is to pick one area to get started with and define it and be consistent with it, meaning you're doing it every single day. I'm not going to do it for 3 weeks and stop, but I'm going to find something that's an improvement. I'm going to do it consistently. That will improve in terms of trying to age gracefully.
So you're talking about possibly exercise or drink more water or make a better food choice.
Start with a heart-healthy breakfast. You want to add more fiber to your diet. I think a great one in this country, because we're flailing, are the fruits and vegetables. The minimum is 5 a day. Can you count 5 yesterday that you had? I don't even worry about the volume. Just count 5 different ones that you had in your diet. That's very attainable and it's measurable. You know if you did it or you didn't. But the benefits there are right in line with healthy aging. You're going to get lots of antioxidants there. You're going to get lots of fiber there. It's high water content, low energy density. It's a win-win all the way around.
Some of the other things that we talked about in managing brain health, let's take a look at the second factor. This is a big one, I think, for a lot of people, and that is sleep. We manage risk factors, and then sleep is so important. We were talking before we even started this chat about when you don't get enough sleep, you feel like your memory's gone, you feel like you just don't function correctly.
Right. Well, and it's so true, you know, and a lot of people think that they have memory problems, and they may not necessarily be primary memory problems. You know, what I always tell my patients is you can't forget something you've never learned. And so if you weren't paying attention in the first place because you're tired, because you're stressed, because you have too many things going on, you don't have a memory problem. You have an encoding problem. You have an attention problem. You have a fatigue problem. So most certainly you can feel like you have memory problems, but that may not be the primary issue that's going on. So certainly sleep is very important.
You know, I wonder, because we talk about sleep and obesity, a lot of literature has come out to say, you know, those who are sleep deprived, meaning less than 7 hours a night, or they're sleeping more than 9 hours a night, we're seeing more issues with weight gain, higher weight. So I'm thinking, well, are we forgetting that our consistent behavior was 5 fruits and vegetables a day? You know, what is that reason? We are seeing, though, that folks who are not getting that good, solid, I would call it restful sleep, not just you being in bed, but you're actually getting restful sleep for a good 8 hours a night, and it helps with the lifestyle side as well.
And they say that basically the time when you're sleeping, your brain and your body repair themselves. Is that correct?
Yeah, there's a lot of evidence, you know, that there's a lot of cellular repair going on. That's when we tend to sort of consolidate our memories. If we've learned new things throughout the day, that's when they really, you know, burrow in and find a place to live in our brain. If we don't have that restful sleep, what we know is that that doesn't happen as well.
And you look at growth hormone. I mean, when you're in that restful sleep, you're seeing the peak, the height of your growth hormone when you're trying to repair those cells. So the older you get, the less growth hormone we have. So the repair process takes a little bit longer, and that's why, again, we really need some good restful sleep.
And you were talking about memory loss. I think just even as you age, you know, you walk into a room, you go, what did I come in here for?
Right.
Is that all normal part of aging, or is that still, you're not getting enough sleep, you're not doing the right things?
Well, and again, it's hard to tell, you know. A lot of people do forget where they've put the keys or what they went to get at the grocery store. You know, and within some certain range, that's not terribly abnormal. But it's really when it starts to become a pattern, you know, when we're seeing a particular pattern, or it's a significant change in behavior or a departure from how that person used to be. I mean, there is normal aging. You know, we know that even the normal brain, even if we do keep it healthy and optimize all of this stuff, that it is going to age. But there's still a certain range that we would expect it to stay within that healthy aging.
All right, before we get to our next point, let's take this question. Doctor, I think this is for you. I drink Rooibos, R-O-O-I-B-U-S. This is how it's spelled, it says, which has no caffeine. I don't know, Kim, if you know what that is. And I've heard caffeine helps with warding off memory loss. So am I more likely to get Alzheimer's?
Well, that's probably a good question. I don't know what Rooibos is, so I don't.
I've never heard of it.
Yeah.
Maybe we can get the person, and I'm not sure who sent that in, to give us an explanation, because I don't know it. I don't know it from the spelling, and I quite honestly can't look it up on the set here. But yeah,
it's hard for me to say about that.
Let's just talk maybe about caffeine. Is caffeine something that's good to ward off memory loss? And if you have caffeine, or you try to have a little caffeine every day, are you less likely to get Alzheimer's? I think I'm interpreting this question a little differently.
Sure, no, and that's a good question, you know, and I think really what it comes down to is there's a lot of different studies that show different things, and I think it all comes down to everything in moderation, you know, that there is some evidence that a little bit of caffeine is kind of helpful. You know, there's also evidence that things like, I think I want to say curry, there's an active, you might know what it's called.
Herbs.
Yeah. Yeah, you probably know more about that. But there are some dietary supplements and things like that that are showing some evidence to have some effect. But really, when you look at some of those studies, you know, if they control for other factors, family history, high blood pressure, things like that, I'm not so sure how conclusive those studies are, but certainly it's an area that we're looking more into. Rather than drinking, you know, 10 cups of coffee a day, I think it would probably be more important to make sure that, you know, you're eating a healthy, low-fat diet, you're seeing your doctor, you're making sure your hypertension is controlled. I certainly wouldn't rely on caffeine alone.
What's your take on caffeine, Kim?
So I think of it as the mental stimulant, and I think a lot of people get that short-term little fix, and it's considered a viable source. Caffeine's not, you know, it's not a taboo. And I think you hit the spot where, are you drinking 10 cups a day, or are we talking about a cup of tea or a cup of coffee in the morning? Maybe
5 Red Bulls.
Exactly. Yeah. There are folks that do that. I mean, and so that's when you're looking at what's moderation in terms of your diet. But you do get that mental little peak up from the caffeine. And so there's nothing, I mean, it's not showing cause that it's going to cause damage to you on down the line. But you're looking at how often you're doing it and how much, I mean, dose-wise that you're ingesting in a short amount of time.
Yeah, and I think if you're not getting sleep, you ought to be thinking about that caffeine, right?
Well, exactly. And to go back to our original point is, you know, if you're overcompensating with your caffeine for your lack of sleep, then probably the better fix is to get some more sleep.
And so you're in a cycle. You start in this vicious cycle. You're not sure which, you know, where you're going to point the arrow to.
Yeah.
All right, here's another question. It seems the older I get, the less food I eat. Oh, that would be nice. But weight gain continues to be on my doorstep. Is there any real reason why this is happening?
Oh my goodness.
Good question.
Well, you know, I brought my pounds with me. So I have my pound of fat and I have my pound of muscle. And I think the answer to that question is, yeah, there's a metabolic reason why it's happening. And I sometimes say to the folks that I'm working with to lose weight, you know, you're going to be 80 years old eating a piece of bread and gaining weight because we keep pulling back, pulling back, pulling back, pulling back. There's only so many calories you have to mess with then. So the fat, unfortunately, burns very little calories per hour. The muscle is going to be what's really going to help us to lift that metabolic rate and allow us some more calories. So the older we get, each year we throw an estimate about 5 calories. You'll lose about 5 calories metabolically each year, which is about 50 calories in the course of a decade. Okay, so you start adding those up over 3 decades. If you're fortunate enough to live in your 70s and your 80s, we might be talking 150